Here, watch this.
Okay.
Yeah.
Let's start over. You don't have to film.
Oh,
You just
okay.
got to hear it.
Miss Cartman, pleasure. Pleasure meeting you.
I could probably call her.
Yeah, so we're thinking, the issue's probably in that left knee. As far as the lump, which is why you brought him in, it's movable. I suspect that's probably a lipoma. I don't think that's related to the lameness, to the, acting ouchy. From what was described, it sounds like the problem is likely knee issue, primarily with the CCL tendon, so cranial cruciate ligament. And what'll happen is it'll either partially or completely tear that ligament, and then they have just instability in the knee when they go to run and play and jump and do all the things a dog's supposed to do. They'll just exacerbate that instability. It'll start hurting them more, and they'll get some effusion in the stifle. So the joint will swell up, and that'll make them to be painful. As far as treatments, we kind of have three options. Two of them are surgical, one of them is just medical. So the two surgical options, the best thing for it would be something called a TPLO surgery, or some people do a CBLO surgery. It's quite invasive. Go in and cut the bone and basically change the angle of the knee. That has quite a bit of success as far as making them more comfortable, but recovery is, you're looking at 3 months of pretty intensive recovery to get them back to where they were. The other option is something called a lateral suture, basically using some suture to go in and kind of mimic what that ligament's doing in the first place, so provide some stability from the outside. Tie that joint in, make it more stable, and that can buy them a lot of relief. Recovery's not nearly as long, but that surgery's not quite as good as a TPLO surgery. And then the third thing is just kind of pain management. That's just treating it medically. We can send some pills home, which we'll probably do today, just to make them more comfortable. And then just as he gets ouchy, give him some pills to make him more comfortable, kind of keep him going and whatnot. Which, that doesn't fix the problem, but it makes them comfortable. And over time, a lot of time they'll throw enough scar tissue at the problem, just kind of something we call a medial buttress, but they'll build up tissue around that joint and try and stabilize it as best they can. So that is also an option. It would be a lot cheaper and kind of keep them going for a little bit longer, going that route. So those are the three options. And certainly if you have any questions or whatnot, feel free to call up and we can talk about those options and figure out what works best for you.
Okay.
All right.
Thank you.
Mm-hmm.
Good class.
So did